EP36, How to Keep Your Eyes Healthy After 60 vision is one of the most taken-for-granted gifts we have, and one of the first to show the effects of aging. By 65, more than 1 in 3 Americans has some form of vision-reducing eye disease. Worldwide, age-related eye conditions are the leading cause of visual impairment and blindness. But here's what most people don't realize. The majority of vision loss in older adults is preventable or treatable if caught early and managed well. Routine eye care, specific nutritional choices, lifestyle habits, and awareness of warning signs can protect your vision for decades. Today, we're covering the main eye conditions affecting seniors and the most evidence-based strategies to protect your sight. Age-related macular degeneration, AMD, is the leading cause of irreversible central vision loss in adults over 50 in the developed world. It affects the macula, the central portion of the retina responsible for sharp, detailed vision, reading, recognizing faces, driving. There are 2 forms. Dry AMD, the more common, slower progressing form, involves gradual thinning and drusen deposits in the macula. Wet AMD involves abnormal blood vessel growth that causes rapid, severe vision loss. Wet AMD progresses much faster, but is treatable with intraocular injections of anti-VEGF drugs, which are highly effective when started early. Risk factors include age, smoking, which doubles AMD risk, family history, UV exposure, and cardiovascular disease. Protective factors include high dietary intake of lutein and zeaxanthin, antioxidants concentrated in leafy greens, omega-3 fatty acids, and not smoking. The ARDS 2 supplement formula, zinc, vitamins C and E, lutein, and zeaxanthin, has strong clinical evidence for slowing progression in intermediate AMD. Ask your ophthalmologist if this applies to you. Cataracts, clouding of the eye's natural lens, affect more than half of all Americans by age 80. They develop gradually, causing progressive blurring, glare sensitivity, faded colors, and difficulty with night vision. Cataracts are highly treatable. Surgical removal and replacement with an artificial lens is one of the most common and successful procedures performed, with over 95% of patients experiencing significant visual improvement. Risk factors include UV exposure, smoking, diabetes, prolonged corticosteroid use, and certain nutritional deficiencies. Protective factors include UV-blocking sunglasses, not smoking, blood sugar control, and adequate dietary antioxidants, vitamins C and E, lutein, and zeaxanthin. When cataract symptoms significantly affect daily function, surgery should not be indefinitely postponed. Deteriorating vision increases fall risk, reduces quality of life, and is associated with accelerated cognitive decline. Glaucoma, damage to the optic nerve, most commonly from elevated intraocular pressure, is a leading cause of irreversible blindness worldwide. It is often called the silent thief of sight because it typically causes no symptoms or pain in the early stages, and the peripheral vision loss it produces is often not noticed until significant damage has occurred. Regular eye examinations, including intraocular pressure measurement and optic nerve assessment, are the only way to detect glaucoma early. Treatment, eye drops, laser procedures, or surgery cannot restore lost vision but can effectively slow or halt progression. Risk factors include elevated eye pressure, age over 60, family history, African ancestry, and being very short-sighted. People with any risk factor should have annual eye examinations. Diabetic retinopathy affects the blood vessels of the retina and is the leading cause of blindness in working-age adults. Among seniors with diabetes, regular dilated eye examinations, at least annually, are essential. Early detection allows laser treatment or anti-VEGF injections to prevent severe vision loss. Tight blood sugar control is the most important long-term protective factor. DRY-EYE syndrome is the most common eye complaint in older adults. Tear production decreases with age, and many medications, antihistamines, antidepressants, blood pressure drugs further reduce tear output. Symptoms include burning, stinging, gritty sensation, and paradoxically, excessive tearing. Treatment includes preservative-free artificial tears used regularly, omega-3 supplementation, humidifiers, and lid hygiene. Prescription anti-inflammatory eye drops are available for severe cases. Ultraviolet protection. UVA and UVB radiation accelerate both cataract formation and AMD progression. Wear sunglasses that block 100% of UV light whenever outdoors, even on overcast days. Wraparound styles provide the best coverage, not smoking. Smoking is the single largest modifiable risk factor for both AMD and cataracts. Stopping at any age reduces risk. Nutrition. Lutein and zeaxanthin, found in kale, spinach, and eggs, are selectively concentrated in the macula and lens and have strong protective evidence. Vitamin C, vitamin E, zinc, and omega-3 fatty acids all contribute to eye health. The Mediterranean diet pattern is consistently associated with lower AMD risk. Blood sugar and blood pressure control. Both are essential for retinal vascular health. Screen habits. Extended screen use doesn't cause permanent damage, but does cause eye strain and dry eyes. The 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. Regular eye examinations. Adults over 60 should have a comprehensive dilated eye examination every 1 to 2 years, or annually if any risk factors or existing conditions are present. See an eye doctor urgently for sudden vision loss in one or both eyes, sudden appearance of many new floaters or flashes of light, a shadow or curtain over part of your vision, severe eye pain or redness, sudden double vision, or the sudden appearance of halos around lights. These can indicate retinal detachment, acute angle closure glaucoma, or other conditions where treatment delays measured in hours can determine the outcome. Your vision connects you to everything you love: reading, faces, landscapes, independence. Protecting it is not complicated. Wear UV sunglasses. Don't smoke. Eat leafy greens and fish. Control blood sugar and blood pressure, and see an eye doctor regularly. Most vision loss in older adults is preventable or treatable, but only if it's caught. See you in the next video.